this topic. So thank you so much, Anusha. Over to you. You can go ahead, get started, and introduce yourself and start with the presentation.
Yes, thank you, Shifa. So good evening, everyone. I welcome you all to today's session. My name is Anusha Deshpande, and I've been practicing as a nutritionist since 6 years now. Firstly, I would like to appreciate you all that you have taken some time out to attend this session. So I hope this session would be informative. So without further ado, let's get started. So today I'll be discussing on the topic that is complication related to diabetes. So Shifa, can we present the screen?
Yes, Anusha, you can go ahead and get share the screen.
All right. Okay. So yes, now we all have heard about various complications related to diabetes, such as nephropathy that has to do with your kidneys, neuropathy that is your neuron, and nerves, and then retinopathy that is to do with your eyes. So today we are going to discuss about diabetic retinopathy. Okay, so I'll just start sharing my screen. So yes.
Anusha, you can just mute the YouTube and you can go to the presentation. Yes.
Okay, is this fine? Yeah.
We're still unable to see your screen. So
yes, how about now? Is it visible?
Yes, you can click on the presentation window and tab basically on the presentation tab. Just there. Yeah.
All right. Okay. Thank you so much for helping me out.
You can click on the present, symbol on top over there next to share, and it will get presented. Yeah, present.
Yes. Thank you so much, Shifa.
Of course, no worries.
Okay. All right. So where were we? Yes. So we were talking about the complications. So today we are going to discuss about diabetic retinopathy. Okay. Not just the retinopathy, there are different complications as well, which we would be touching upon. So impact of diabetes on your vision. So uncontrolled diabetes can impact your eyes and the vision. Okay. And these are three most common complications that we get to see. One is diabetic retinopathy, and then the cataract and glaucoma. Okay. So before we discuss about this particular complication, I want you all to understand the science behind your glucose uptake and what happens in non-diabetic person, what happens in diabetic person, because somewhere I feel that we are not aware about the concept clearly, due to which we fail to understand the seriousness of the complications. Okay, so here's a video which I would like to show you all. But before that, I will just explain you quickly how this glucose uptake takes place. Okay, so whenever we have food, this food gets broken down into simpler molecule, that is glucose. Glucose is nothing but the energy source for your cells, for your whole body. And that is how we stay active and we are energetic. Right? No. Now, whenever this glucose is released into the bloodstream, the pancreas starts secreting insulin. So insulin is the hormone which pushes the glucose inside the cell. And that is how we get the energy. And that is how the glucose flow in the bloodstream reduces. So here is a video which I would like to present to you all for the simpler and better understanding. Okay. All right, so as you can see, there's insulin receptor and there is something called as GLUT4 transporter. So here comes the insulin. It attaches to the insulin receptor, and that is how the GLUT4 comes to the surface, and it allows your glucose to enter the cell. Okay, I hope this concept is clear. This is how the glucose uptake takes place. It's very simple. Okay, I'm not getting much into the technicality. I'm trying to keep it very simple. Okay, so this is a cell, this is the insulin receptor, GLUT4 transporter. So let's think of it as Okay, so I visit your home, okay, and I'm with my friend, and then I ring the doorbell, and then you, being the owner of the house, you're the glued-for who would come to the doorstep and you will open the door for me, okay, and I'm the insulin and my friend is the glucose, and that is how you will invite my friend inside your house. So this is the simple concept of the glucose uptake, okay. Now, what happens in diabetes? What happens in insulin resistance? Okay, so see, this takes place in non-diabetic person. So in diabetes, in insulin resistance, your body becomes resistant to the insulin. Now, what does that mean? So if you can see here, this is the insulin receptor. Now, because of the faulty lifestyle for years, okay, so there is fat deposition onto the surface of the cell, due to which there is blockage of this insulin receptor. Okay, now the insulin cannot get in touch with this insulin receptor because of this blockage. And that is why this glued-for, it stays deactivated. It never comes to the surface of the cell to receive the glucose. And this is the insulin resistance we talk about. So to get rid of this insulin resistance, what we are supposed to do, we are supposed to burn this fat layer by following a very healthy lifestyle, by doing good, like at least 30 to 40 minutes of physical activity, and by following a calorie deficit diet. So I hope I'm clear with this insulin resistance concept. Right? So I'll take your questions by the end of this session. I'm sure you guys must be having too many questions, which I would be taking it up by the end of the session. Now there is next video, which I would like to explain you all. Okay, so I hope the screen is being shared.
Yes, Anusha.
Yes. All right.
Yes.
Okay. Now, this is the another diagram which I want to show you. Now, what happens to the glucose in case if it is not getting inside the cell? Where does this glucose go? It actually starts flowing in the bloodstream, and that is how the pressure develops in the bloodstream because of the presence of too many glucose molecules. Okay, so now this is the blood vessels. If you all can see, this is the blood vessels, and this is the border at both sides of the blood vessels. So let's call it as endothelial cell. Okay, and this is a basement membrane. Let's call it as a mesh or a gate. Okay, now as there was a glued-for transporter in that video one, similarly here also we have another transporter which helps to transport the glucose inside the cells. Okay, this is called as GLUT1. But the difference is glued-for is dependent on insulin. Okay, it wants insulin's permission. But here in GLUT1, it is independent of the insulin. Okay, so it invites everybody into its cell. So let's have a look at this video. So if you all can see, there is a flow of glucose in the bloodstream, excess flow of glucose in the bloodstream. So this GLUT1, it invites the glucose to its house. Now, what happens at the border? So there is some kind of a negotiation that goes around. Okay, so this glucose, it enters the border. Okay, and there's one more molecule present in this endothelial cell which attaches to this glucose and forms the whole other modified molecule. Okay, so here this is how it happens, and this is no more a glucose, this is no more an energy source. Okay, so it's kind of a waste. So what this particular molecule does, it goes to the gate. Okay, it just wants to get out of the border, so it goes to the gate and it attaches to the gate and starts damaging the gate. Okay, it's like, you know, it's like a mesh on the window. It starts damaging the mesh, thereby developing a huge pores between the mesh. Okay, now why these borders are important, let me tell you all. Now this border prevents from the leakage of not just the glucose but the other molecules also into the surrounding, into your tissues. Okay, now so these are certain molecules which should be floating around in your blood vessels. So once that gate is damaged, once the pores enlarges, this particular protein, okay, this is a protein, this is the albumin, it starts getting out of the blood vessels. Okay, now once it starts getting out of the blood vessels, what does the body do? This water molecule in our body, it starts secreting outside this thing, because it flows in the fluid, right? So this water, it starts pushing the protein inside the blood vessels, due to which the pressure is developed onto the blood vessels. See, it starts pushing, and that is why it constricts your blood vessels, okay, due to which that constrictions leads to the pressure developed on your blood vessels and thereby damaging the blood vessels. I hope I'm clear with this concept, because if you understand this concept, I'm pretty sure you're going to understand every other concept that I'm going to talk about diabetic retinopathy. Okay. So yes. This is how the structure of our eyes look like. Okay, now this is the inside structure of the eyes. Now today we are going to talk about retina, because diabetic retinopathy, it usually affects your retina. Okay, so this is a pupil, this is a lens, and this is a retina. Retina is a light sensitive tissue which lines the inner surface of the eyes. Now what is the function of retina? Whatever image that we see, okay, it senses it, it sends the signal to the brain through this optic nerve, asking for the brain to reflect that image. And that is how we get to see. Okay, now these are few blood vessels, okay, which nourishes the retina. Now, how do we get nutrition? Okay, through these blood vessels, we get oxygen, we get nutrients. So it's very important for us to take care of these blood vessels. Okay, so these blood vessels nourishes the retina. Right. So now let's start with today's topic, that is diabetic retinopathy. Now, what exactly is retinopathy? It is caused when the high blood sugar damages the blood vessels in the retina. As I mentioned, how the blood vessels get damaged. So it's a light sensitive layer of the cell in the back of the eye. Okay, and the damaged blood vessels can swell and leak. Remember, I told you about leaking of the molecules into your surrounding, and it will start leaking, causing the blurry visions or stopping the blood flow. So this is how normal eye looks like, and this is how eye with retinopathy looks like. Okay, so there is a leakage due to which there is a blurry vision because of this fluid secretion. Now, early signs of retinopathy. Now, what are the early signs of retinopathy? So these are cloudy visions and, trouble seeing at night, blurry visions, and even sometimes we do happen to lose the visions as well, and we see floaters or spots. Okay, so it's like some sort of the worm like texture that we get to see. Okay, so these are the early signs and also the symptoms of retinopathy. So these are the symptoms that you need to look out for. Okay, spots in your vision, cloudy vision, blurred visions, and yellowing of your vision. Why? Because your blood vessels are damaged, due to which it is not able to pass the oxygen and the nutrients, due to which, because of the deficiency, you can see yellowing of your vision. Now, there's something called as glaucoma. Now, we are done with the retinopathy. Now, let's start with this glaucoma. What is glaucoma? Okay, it is a group of eye disease that can cause vision loss and blindness by damaging a nerve in the back of your eyes called as optic nerve. Remember, I showed you that optic nerve, which means that retina, it passes a signal through the optic nerve. So that gets damaged when it comes to glaucoma. Now, how that happens? So this is the smaller image. I would like to show the enlarged image of it. Okay, so this is the lens, and to this there's a lot of support system going on here. So if you can see, this is a ciliary body which secretes the fluid. If you can see, there's a fluid around the eyes. The ciliary body secretes that fluid, and there's a drainage canal also on both the sides, okay, which drains excess of the fluid. Okay, so that's how it maintains the equilibrium. Okay, so it secretes the fluid and that balances the excretion of that fluid. Okay, drainage of that fluid. Now, because of this, the high sugar level, these things get damaged. Okay, the drainage canals are damaged, due to which it is not able to excrete, it is not able to remove the excess fluid. Now, because of which there is fluid secretion going on over here, which presses the lens, so it pushes the lens inside. Okay, so this is why this pressure is developed onto this blood vessels and again onto the optic nerve. So this is how the optic nerve is damaged, okay, causing the total blindness. So initially, glaucoma doesn't usually have any symptoms, okay, but over time, we slowly start losing the vision, okay, especially the vision that is closest to your nose, that is called as peripheral visions. Okay, so those were the complications. Now let's try to understand the ABCs of diabetes and eye health. Now, how can we take care of the eye health? Okay, what are the things, what are the factors that we need to focus upon? So these are the ABCs. So let's just go one by one. One is A1C, that is HbA1c. Now, HbA1c is very important. Okay, it is checked once in 3 months. So please make sure to get your HbA1c test done once in every 3 months. Okay, so usually like below 5.7, it is non-diabetic, 5.7 to 6.4, it is pre-diabetic, and 6.5 plus, it is diabetic. Okay, in case if your HbA1c is somewhere around 10 or let's say 11, 12, at least try to maintain it below 7 or 8%. Okay, now coming to blood pressure. Now, why blood pressure? Okay, why you need to maintain the blood pressure? It's not just the high sugar level, but also your blood pressure causes damages to the eyes. Sometimes people do realize that they have hypertension when there is issue with their eyes. Okay, when they visit the doctor, that is when they realize it is because of the high blood pressure. Now, how? So let's imagine, let's take balloon as an example. Okay, so we blow air into the balloon. So it will fill up until its capacity, and once we go beyond its capacity, it is going to burst. So similarly, when there's rush of the blood, the blood into the blood vessels, when there's a pressure developed onto the blood vessels, that is how the blood vessels will get damaged. Okay, so we need to take care of our BP as well. Now, why cholesterol? So cholesterol usually, it creates plaque in the arteries. Okay, so it blocks the flow of the blood. Okay, because there's a deposition which is taking place into the blood vessels, due to which again it becomes constricted. The blood flow becomes constricted. So you need to maintain your lipid profile as well. Okay, if your cholesterol level is in check, your blood level would be the blood pressure would be in check. Okay, now coming to smoking. Now, don't smoke. This is like, there's no negotiation over here. Okay, so we do tell sometimes when it comes to the dieting that it's okay, you can have, slowly you can reduce, but when it comes to smoking, it's a very strict no. So I'll tell you why. So let's all do a simple activity today. Okay, so I'll just set a timer of 30 seconds. I think 30 seconds would be too much. Let's just set a timer for about 20 seconds and let's see if we can hold our breath. Okay, I hope you all are ready to do this activity. So let's start. I'm just going to start. So on the count of 3, 2, 1. Okay, that's it. I could hold it for 20 seconds. I don't know about you all. I think I should have increased this up to 1 minute or something. All right. So the reason why I asked you all to stop breathing for 20 seconds. So did you see that gasp of breath that you all guys wanted? You wanted to just breathe. Now, this is what is happening inside your body. Your tissues, your blood vessels, these all need oxygen. Now, imagine if you're smoking a pack of cigarette. You are introducing the chemicals, the 4,000 unwanted chemicals in your body, such as carbon monoxide and other poisonous gas. So what these gas do, it replaces the oxygen in your blood vessels. Okay, so it makes your blood vessels and the tissues a deficit of the oxygen that it requires. Okay, so imagine we couldn't hold it for 20 seconds. So imagine what is happening inside the body if we keep smoking. So that is why please stop smoking. Smoking also affects your the blood vessels, and that also constricts your blood vessels because of the deposition of few plaques and other items which constricts the blood vessels. So please make sure not to smoke. Eyes, get an annual checkup done. Okay, it's very important for every diabetic person to make sure that you're going for the eye test. Okay, annual eye test has to be done. It's very important because see, this retinopathy, glaucoma, we do not realize that we do have these complications until we have symptoms, because we all start with being asymptomatic, and all of a sudden we start seeing the symptoms. So please make sure annually you're getting your eye test done. Okay, so now we'll talk about the food for better eye health. See, we all are aware about the food. Like, for example, vitamin A is good for eyes, which is present in beetroot, carrot, spinach, and few fruits, which are colored fruits. But what we are failing to do here is we are not having it regularly. Okay, we have beetroot once a week, we have carrot once a week. Sometimes people have fruits once in a while. So it's just that we are aware about the sources of certain nutrients, but we are not able to have it on regular basis. We need to have it quite often. So fruits are packed with antioxidants, nutrients, and vitamins. Okay, so this can prevent complication of the eyes. Now, why whole grain? Okay, why is it important to have whole grain? Because whole grain has something called as fiber. It's a nutrient. So what is the function of this nutrient? It slows down the absorption of the glucose. Okay, thereby it leads to the slow and steady rise in your sugar level. And not just the glucose level, it also helps to manage your cholesterol level. So excess of cholesterol level is excreted in the body through this fiber. So make sure that you're having fiber on regular basis. Okay, you're having your breakfast, lunch, and dinner. And I've seen many people just eating rice and sambar, rice and dal. So there is no fiber in the rice, and this will lead to higher sugar level. So please make sure to add something, to add raw form of vegetable, to add cooked form of vegetable. So at least maintain the ratio of 50%. Not necessarily that, you need to have 50% of raw vegetable. At least try to manage the ratio between the cooked vegetables and the raw vegetables. Okay, but make sure that 50% of plate is filled with cooked plus raw vegetables. Okay, and plant-based protein. Now, why plant-based protein? See, you can even take animal-based protein such as egg white. It is the high biological value of the protein that can be included. But again, diabetes, this cholesterol, and the heart disease, these all are interrelated. So we need to take care of everything. Okay, so please make sure that regularly do not refrain yourself from having non-veg, especially the non-veg which is cooked because I've seen people cooking non-veg they put too much of butter, too much of ghee, and they have this barbecue and this deep fried kebab non-veg. So don't have such sort of non-veg. Even if you're having non-veg, make sure it is boiled form or grilled form, prepared at home in the form of curry. Okay, even when it comes to choosing the non-veg, which part of the non-veg you're supposed to eat? Fish. Okay, and also the chicken. When it comes to the chicken, only the breast part, not the other part of the leg piece and all these things. You should avoid it. Have only the breast part because it is rich in protein. Okay, now, but having said that, for me, plant-based protein is always the best. I feel like, it's kind of safe to have plant-based protein. Plant-based protein is present in legumes, your lentils and your almonds, your nuts and seeds, and also tofu, paneer. So these all are options of the plant-based protein, but make sure to have it regularly. Okay, once again, I'm going to tell you that because rajma is not supposed to be cooked once a week. Okay, yes, once a week, but again, along with the rajma, make sure that you're cooking chole the next day. Make sure you're preparing this hurli kalu we say, the horse gram, the next day. So one day have some sort of protein. Okay, regular intake of these nutrients is very essential. Okay, now coming to omega-3 fatty acids. Now, why omega-3 fatty acids? Because it manages the lipid profile. It boosts the good cholesterol, that is HDL, high density lipoprotein, and it it lowers down the bad cholesterol, that is LDL. Okay, low density lipoprotein. Okay, now what are the examples of omega-3 fatty acids? Flax seeds, walnuts, chia seeds, and even fish, the fatty fish, that is salmon. Make sure in case if you're having fish, have salmon. Not only the protein, it will also give you omega-3 fatty acid, which will help to manage your lipid profile. Okay, now people often ask me how to have flax seeds. Be it in any form, not necessarily it has to be powdered or roasted or anything. It can be in any form, but make sure that you're at least having it. That is very important. Okay, you can mix it. You can add 2 spoons of flax seeds in your chapati dough, and you can prepare chapati out of it. And you can mix it in the fruits and you can have it. Okay, so such things can be done. Walnuts, make sure to have walnuts on regular basis along with the soaked almonds. Yes. So 5 ways to prevent diabetes eye disease. Okay. As I told you, annual checkup is very important. Eye examination is very important once a year, and keep your blood pressure and cholesterol level in your range. Okay. Well, what is the range? Below 200 mg per dl is your cholesterol, 150 below it is your triglycerides and the other lipid profile you're aware about. So make sure that you're maintaining it within the range. Even your sugar levels, make sure that your fasting has to be between 90 to 100, and your post meal is somewhere less than 140. If you are a person who always hits 200 plus, make sure to at least try to maintain it below 140, but the ideal range is 100 to 120 mg per dl. Quit smoking. As I told you, this cannot be negotiated. We have to quit smoking and get active. Physical activity is very important, especially the strength training. I have seen many people going for a walk. That is very good, like, good form of physical activity. At least you're doing something, right? You're going for a walk. But again, at one point of time, your body gets used to it and walking becomes nothing. Okay, walking is just like, some different activity that we do on our regular basis. Make sure to introduce strength training in your routine, because this strength training, it helps to burn your fat mass, okay, which is very important. Remember, I told you the fat deposition onto the cell that we have to burn, okay, that we want to get rid of insulin resistance and reversing your diabetes. So make sure at least 30 minutes of strength training is what you're doing. Get around 2.5 or 5 kgs of dumbbells and just start lifting it. Very simple exercise that you can do at home. So yes, I think we are done with the slides.
Yes, thank you so much, Anusha. It was a great, session. Thank you so much for the wonderful presentation. I think we can now move on to the Q&A session, right? So we have a couple of questions already, but if any of you have any questions, feel free to drop them in the comments, and we'll be taking up questions now, right? So we had a lot of questions about exercise recommendations, which I think you've already covered. But you've spoken about strength training extensively, right? But if someone is a beginner to exercise, what is something you would recommend them to start off with?
Okay, that's a very good question. So firstly, I have seen people hitting the gym and doing 3 sets and 20 repetitions or more than that. Please do not do that. Start very slowly. Okay, start with the dumbbells. As I told you, order 2.5 kgs, 2 kgs, and for men, you can start with 5 kgs of dumbbells. So purchase it, keep it at home. You don't have to go to the gym, just start at home. There are many exercises like, your arm related, a very simple exercise, shoulder press. You can just do this sort of exercise with the dumbbells. So this is called as anti-gravity exercise. Again, I don't want to dive deep into this technicality, but there's something called as anti-gravity exercise. When you go against the gravity, okay, when you, for example, stair climbing exercise, when you walk against the gravity, there is better glucose uptake by your cells. Okay, so get these dumbbells, do some sort of there are many YouTube videos available, even in the Besugarfit also, there are many videos available which would help you with this dumbbell exercise. And lunges, squats. So these all, you don't require weights. Okay, and then once you are used to this kind of strength training, and that is when you can go and join the gym, where you can use certain machines which are at the gym.
Got it. Thank you. So another question they were asking about was, are there any, non-veg dietary recommendations that you have for someone, who is non-vegetarian and, who also has diabetes? So what would you suggest for them? Any precautions or any suggestions?
Yes, I see. One thing is that I do not put restrictions on non-veg. Non-veg is also good. Okay, it's not that, only plant-based diet you're supposed to have. In case if you're non-vegetarian, you can have non-veg, but make sure that your lipid profile is in check. Okay, your cholesterol, your triglyceride. If your cholesterol level is somewhere around 700, if your triglyceride is also around 700, that is when you need to avoid non-veg. Okay, but please make sure that when it comes to other non-veg source, egg, it is the high biological value of the protein, which means all essential amino acids, they're packed in this egg. Okay, so you can depend on the egg. And fish, as I told you, salmon fish, Not only it is rich in protein, but it is also rich in omega-3 fatty acid. But again, as I mentioned, it also depends on the cooking style. Make sure not to have like, the fry and the kebab form, not these forms. Make sure to have it like, like salmon based curry, or some like chicken breast curry prepared at home, sambar. So these sort of non-veg you can take. But yeah, again, once in week, fish, and once in week, once in 15 days, chicken. Yeah. I hope I answered that question.
Definitely. Thank you, Anusha. So we have another question. They're asking about what can you do in case you have high triglycerides? Are there any, suggestions that you want to give for that?
This is very good question, because many of us, we think that when we have deep fried food, that is when our triglyceride level shoots up. That is not true. Okay, even when you have high carb diet, okay, excess carb diet, it gets converted into fat at the end. Okay, so that will also lead to high triglyceride level. So make sure, see, when it comes to fried food, we do not have it every day. We do not have bhajis every day in the evening along with the chai, right? It is once in a while, once it starts raining or something. But carbohydrate is the one that we eat for all 3 meals, that is breakfast, lunch, and dinner. Okay, so please make sure that your carbohydrate intake is in check. Make sure to increase the fiber intake, make sure to increase the protein intake. So this way you're balancing your meal and you're not only relying on the carbohydrate, and that is how your triglyceride level would also be in check.
Got it. So there is another question, Anusha. They're asking like when it comes to the intake of milk, right, for people with diabetes, or oil for people with diabetes,
Yeah.
what would be your recommendations for that?
Okay, so I'm loving all the questions. So now when it comes to milk, so see, milk has a milk sugar that is called as lactose. Okay, so and first of all, in adulthood, milk is not required. In case if you're looking for the calcium source, there are other calcium sources. Okay, sesame seeds, and there's green leafy vegetables. And as I told you, when it comes to the sources, we all are aware about the sources, but it's just that we do not eat it quite often. Okay, doesn't mean that you're you can have spinach weekly once, have it weekly twice, have it every alternate days, have sesame seeds every alternate days. Okay, so that's how you'll meet the calcium requirement. Now, when it comes to the milk, it is really not required for the adult body. Okay, because the growth has already taken place. It's just that we are maintaining it. So milk is really not that important. But yes, for the tea and coffee, because tea and coffee daily twice will be drinking that, and everybody needs that boost, okay, to function better throughout the day. So you can take it along with the tea and coffee. But again, make sure that just because I said you can take tea and coffee doesn't mean that you can take 4 or 5 times a day. Okay, just restrict yourself to 2 times a day. Okay, so lactose is something that you need to avoid. And I know you are thinking about other things also, like milk-based products now, like for example, curd and paneer. These things you can take. Okay, now why? Because see, milk, when it curdles, the lactose in the milk gets converted into lactic acid. So that way it is safe to have for diabetes. Okay, that won't spike your sugar level. Okay, and the next question, I think it was about the oil, right? See, when it comes to oil, as we all know, groundnut oil is good, and safflower oil is good. And nowadays, we say cold pressed oil is also good. Okay, because it retains vitamin E. And also make sure that, thank you for reminding me, because I remember to tell you all about the olive oil. Okay, in case if you're using olive oil, make sure that virgin olive oil is what you're using in the salad. Okay, and do not use virgin olive oil while cooking. Okay, because it is not fit for cooking. Okay, so now when it comes to the salad preparation, make sure to add this olive oil so that the absorption of certain antioxidants, certain nutrients, vitamin A is much better in the presence of the vitamin E present in the oil. Okay, but apart from that, whatever vegetable oils that you're using, make sure to use it in limited amount. Okay, just remember not to make sure not to float it on the katori of whatever sabzi you have taken. And even certain sabzis, like for example, if you are preparing bhindi ke sabzi, bottle gourd sabzi, these do not require much oil. Okay, very for shastra you can add 1 or 2 spoons and just sprinkle water. Okay, it will help to cook the vegetables. So yeah, that should be your quantity of the oil while preparing.
Got it. So Anusha, there is another question. They're
Yeah.
asking about what are the fruits that people with diabetes can take, and what about the quantity and everything of that sort?
Okay. So I will mention the fruits that you're not supposed to take. One is banana, sapota, jackfruit, mango. I do understand mango is seasonal. Good, it is seasonal, or else we would have had it on regular basis. So yes, these are the fruits that you're supposed to avoid. Now, other fruits such as apple, pear, guava, and green apple and kiwi fruits, all sort of citrus fruits, even grapes for that matter. You can have a little amount of grapes, even watermelon also. You can take around 1 katori of watermelon or papaya, but not more than that. Okay, muskmelon is safe to have. Okay, now see, the thing is, certain fruits have fiber in it. Now, whatever fruits that I mentioned, such as banana and sapota and sitafal, jackfruit, these all lack fiber. Okay, so these should not be taken because these are going to give a huge spike to your sugar level. And honestly speaking, there's no much nutrients around this compared to the other fruits, what I just mentioned. Like, the vitamin C, the other nutrients are also present in this, other minerals are also present in this fruits. Yeah, so make sure to to have these fruits.
And what about dry fruits, Anusha? Like what do you suggest about that?
Jackfruit?
Dry fruits.
Oh, dry fruits, yes. So dry fruits, see, it is a concentrated form of sugar. Okay, so see, okay, so the apricot, the fig and all, it comes from the fruits itself. So they remove the water part and again it becomes a concentrated form of the sugar. Okay, do not take dry fruits. But yes, you can take nuts. Like, people often they get confused with the nuts and the fruits, the dry fruits. So nuts are almonds, pista, walnuts. These things you can take safely. But when I talk about dry fruits, such as dates and figs and apricots, these are the things that you need to avoid. Okay, instead of that, have fresh fruits. And in case if you're a sweet tooth person, okay, and if you're craving to have sweets, have half a piece of fig or apricot, or let's say like one date maybe. Okay, so that will stop the craving of the sweets. So that is when I tell people to eat dry fruits, or else it is really not required.
Got it. Excuse me. Anusha, there's also another question, if someone has a very high, blood pressure, what are the,
Mhm.
precautions that they should be taking, or what are the dietary things that they can do in order to bring their blood pressure down?
Okay, so you might have heard about this DASH diet where we have to restrict ourselves from salt. Okay, so make sure, see, the only advice that we can give when it comes to the hypertension is you need to reduce the intake of salt. So whatever salt that you're adding in the food while cooking, that is more than enough, but make sure not to add it again, like, onto the side of your plate. One more thing, I have seen people adding salt to the rice as well. Please make sure not to add that. Okay, don't add salt to your rice because that is really not required. Sabzi and all, I do understand you can add it, but and also don't add this salt to the fruits. I've seen people adding salt to watermelon, so that also needs to be avoided. And certain processed foods. See, whenever you go outside, whenever you buy, make sure to read the nutritional label. I'm pretty sure each and every item in the store that is available, it's all like, they all have the sodium in it. So please make sure to have a look at the nutritional value and avoid this processed food. Avoid Pringles, no matter even if it is baked or what. Don't have these things. Okay, just depend on, like, organic, fresh fruits, fresh vegetables. Don't take this processed food.
Got it. So another very interesting, question, Anusha, they're asking, can we eat jaggery instead of sugar? And how about sugar-free? What would, you suggest for that?
Yeah. Okay, so I don't want to be very blunt and I don't want you all to hate me for saying no to the jaggery. But yes, see, when it comes to, in case if you're a person who is used to taking too much of sugar in the tea, okay, so I won't tell all of a sudden to, like, cut down on having sugar. Replace it with jaggery. But again, the quantity matters. Okay, that doesn't mean that you're taking equal amount of jaggery. Just reduce it to half the jaggery and then slowly, slowly start to reduce it. See, jaggery it is it is packed with few nutrients. Okay, like there's iron and all in it. But again, it depends on what jaggery you're taking. If you're taking that very like light colored jaggery, that doesn't have much iron in it. But if you're taking that black and brownish colored jaggery, that has got iron in it. But again, when it comes to iron source, do not depend on the jaggery. Okay, there are other things also. There are other sources also for the iron which you can depend on. So make sure to look out for those sources. But jaggery and sugar, now when we talk about the calorie distribution, both are same. There is no difference, okay, because we have seen the glucose spike after the people who had jaggery and who had sugar. It has given us a same spike. So both are same kind of, but make sure that, slowly you're reducing. First convert jaggery, like sugar into jaggery, and then again, like slowly, gradually, you stop taking jaggery as well. Oh, artificial sweetener is what you mentioned about. One more thing. Yes, artificial sweetener. Yes. So in the long term, in the long run, it is not good. See, for now, it is fine. The stevia is okay. Stevia you can take. But I have often heard people complaining it is bitter in taste. It doesn't taste good and all. And also one of my clients, when I was discussing with him, he mentioned about a sweet mart who prepare sweets. That is without any sugar or jaggery, it is stevia based. But we did not see much spike in the sugar level. But yes, there was a spike, but not what I expected. So stevia based sweets or stevia also, you can add it in the tea or coffee. But artificial sweetener, no, not in the long run. It won't be helpful.
Got it. So, Anusha, there's one question where they're asking, can we add fresh cream to our tea and coffee instead of milk? Because that gives us both protein and fat. What would be your, suggestion on that?
It would give protein and fat, the fresh cream.
Yes.
No. See, I would not say to take fresh cream. Instead, you take milk, because again, there comes the fat. Milk, there's a skim milk which is available. And my best suggestion for you would be, why to go with the fresh creams when there's alternate milk that is available in the store, such as almond milk, soy milk, and many other milks are available in the store. So you can use them instead. You'll get protein from there also. But again, fresh cream comes with the fat. So I don't think it is very safe to take it on regular basis. Fresh cream, we do add it in some desserts that we make, that is once in a while. But to take it along with the tea and coffee, no, I would not suggest that. I wouldn't recommend it.
Got it. Thank you, Anusha. So there's another question, right? They're asking if someone is, in their 50s and have a, borderline, blood sugar levels, what do you think is the first step that they should be taking in order to, prevent the progression to diabetes and, everything, the complications and everything?
Yes. So I have seen many people with such scenario, with such cases, if you're at the borderline. Okay. So make sure that you, for 3 months, set a target for yourself for 3 months. Think of it as some semester exam that you're giving and you're preparing for the exam. Okay. So just prepare for 3 months. What you can do is start with a walk. See, if you are around 50 years old, then I would recommend you to start with the brisk walk first. Okay. And do some simple form of exercises. As I mentioned, the shoulder press, this is very easy. Anybody can do it. Okay. And this waving of the hand also, you can do it. And high knees, very slowly, such sort of exercise you can do. But make sure, for about 20 minutes, you're going for a brisk walk. And after that, for 10-20 minutes, you do this sort of exercise, or even Surya Namaskar. It stretches your whole body. Okay, so it'll start with 5 Surya Namaskar a day, and then extend it up to 10, then 15. So like that, you can keep increasing. Coming to the diet. See, one thing is that you might have heard about the ratio 80:20. 80% has to be diet, 20% has to be physical activity. Okay, so imagine what all you have to do for the diet. See, do not complicate so much. It's just that the choice of the food that we make is very wrong. Okay, you're having breakfast, lunch, and dinner every day. We're not asking you to skip your meal. We're asking you to change the way you have. Okay, change your plate. Okay, make sure that instead of rice, there is red rice, or make sure instead of that red rice, there is millets. So weekly once, in a week, you can divide it this way, because I'm sure you cannot have millets on regular basis in case if you're not used to. So weekly twice, you're having millets. Weekly twice, you're having red rice. And weekly 2 times, you're having white rice. And the rest of this thing, there's no rest of the days but week, but still you can have jowar roti, or you can have chapati and other millet based roti, millet based dosa, or pesarattu, which is protein rich. Replace your normal dosa with pesarattu, because normal dosa, the ratio is 3:1. That is, three is that rice, dosa rice, and one is the urad dal. So again, that becomes a carb dense. Similarly, your idli. So replace these things with moong dal idli, or pesarattu, mixed dal dosa. So replace your food with some healthy meals. Now, when you look into your plate, you should search for the protein. Okay, because all we can see is carbs. Now, if you have served yourself anna and sambar, rice and sambar, you should see, okay, where is the protein in my plate? Okay, if there is no protein, add protein in your plate. Add this curd, add eggs, add some rajma or this lobia based salad, and add some cooked form of vegetable. But make sure that you're maintaining this ratio. Okay, so here I'm going to tell how you're supposed to design the meal. Make sure to have it from today. Okay, so first you need to serve in your plate 1.5 katori. Okay, one katori is almost around 150 grams of the cooked weight. So 1.5 katori of cooked vegetables, 1 katori of raw vegetables at the beginning, because we just want to avoid that bloating part and all those things. And then 1 katori of curd or buttermilk if you wish to take, and then only 1.5 or 1 katori to 1.5 katori for the beginning as rice, or maximum 2 chapatis or 2 jowar rotis, which are of like medium and thin this thing consistency. Okay, so make sure you have this way. Then only you will be able to not go into that diabetic phase. Yeah.
Got it. So there's another question. They're asking if someone who's also having some heart condition, or something related to the heart, and they also have diabetes. Are there any special precautions that they should be taking in terms of their diet?
Yes, as I explained, see, you have to balance your meal. That is all it takes. Okay, so as I told you, even when it comes to triglyceride, excess carbs will surely get converted into fat in your body. So you need to balance your meal. Okay, for example, this veg meal I already spoke about, like 1.5 katori. Now let's talk about the non-veg meal. Okay, because yes, because I think I haven't spoken enough on the non-veg meal plating. So what you're supposed to do is, again, take 1 katori of raw vegetables. Okay, and 1.5 katori of cooked vegetables. Take 3 egg whites, or you take 100 grams of chicken breast in a grilled form, and or you can take 100 grams of fish. Okay, now when it comes to this veg, as I told you, the rajma based salad, the chole based salad, and the lobia based salad, or lobia curry, or this green gram curry. So these things also you can take. Okay, so see, it's all about balancing your meal. Okay, it's very simple. So look for the fiber, look for the protein. Now, why fiber? As I explained you, fiber not only it helps to manage your sugar level, it also helps to manage your cholesterol level. It removes the excess cholesterol from your body. Okay, so make sure that you're taking enough of fiber. Now, when I say enough of fiber, how much fiber? So for every 1,000 calories that you're taking, you need to take around at least 15 grams of fiber. So that way, somewhere around 25 grams. So because we don't take 2,000 calories, we take around 1,500 to 1,800. So somewhere around 25 grams of 25 grams of fiber is what you need to take. Now, again, your next question would be, what are the food that are rich in fiber? All sort of raw vegetable. These are rich in fiber. Whole grains. Refrain yourself from eating maida, white rice. Okay, as I told you, white rice need to be taken weekly twice. Okay, but make sure that you're introducing this red rice, millets, and all these things in your diet to meet the fiber requirement.
Got it. So Anusha, there's also another question where they're asking, like you spoke about jaggery and sugar-free, but they're also asking, what about other sugars like coconut sugar? Like, are those also not possible, to be taken?
Yes. So coconut sugar, again, it depends on the processing and the brand that you're using. But coconut sugar, I haven't seen spike. You can take coconut sugar, okay? You can, but I'm not sure whether you can add it in the tea or coffee, because I have never added. I don't know how it tastes, but you can try it out and you can see for yourself. But yes, That way, compared to jaggery and sugar, coconut sugar is a great choice. And apart from coconut sugar, I don't know what else sugar are there. I'm not able to recall it, but yes, that you can take.
Got it. And also, Anusha, what about the quantity of eggs of per person per day? Like, is there any quantity that we should be looking into, and can we take whole eggs or only egg whites?
You can take whole eggs, okay? But again, the quantity matters, okay? Do not take more than 2 whole eggs in a day. But again, 2 whole eggs, not at one go, okay? Make sure to have 1 whole egg in the morning, 1 whole egg in the evening. But when it comes to egg white, you can take around, this is what I suggest all my clients, take around 4 eggs in the morning. I'll tell you how. The ratio should be 1 plus 3 egg whites and 1 whole egg for breakfast, and for evening, like for the dinner, similarly 3 egg whites and 1 whole egg. This much you can take. See, there is no restrictions in the egg, but again, how much can you have? You can't have more than 10, right? But to meet the protein requirement, if you're a person who is looking for the protein requirement, so it's very simple to take eggs. As I told you, high biological value of the protein, and 1 whole egg gives you 6 grams of protein. So 1 egg white will give you around 3 grams of protein. So that way you'll be meeting around somewhere 12 to 15 grams of protein just through eggs. And the other things also comes, like dosa, in case if you're having peserato dosa, that will also contribute to 7-8 grams of protein. So it will help you to meet the requirement of 25 grams of protein in just one meal. Now, when it comes to protein requirement, for women, it is 50 grams of protein, and for men, it is 60 grams of protein. So just divide it 20, 20, 20. So that's how you're supposed to take.
Another question, Anusha, is basically on cheese. They're asking, can people with diabetes have cheese? And is it something we can include in the diet? And how much should we actually take?
Okay, so are you a person who has cheese on regular basis? I don't think so. But if yes, then I think you shouldn't. So please make sure not to have cheese on regular basis. Once in a while, it's fine. To add this feta cheese onto your salad, it is okay, because how much can you have? Like only a few pieces of the feta cheese. But you asking for that toast and the cheese slice, and again, see, the processing is involved. Even the taste of the cheese, you can make out how much sodium is there in the cheese. So make sure to refrain yourself from these things. But again, see, let's restrict ourselves. Okay, there are 2 words: restrictions and avoidance. I never tell avoid. I always say restrict. Restrict yourself from having cheese and other things. Like once in a while, it is fine to take cheese, but not on regular basis.
So there is another question. So they're asking, they have recently done a cataract surgery, but they have little blood spots, they're saying, in their eyes. And they're asking, will that impact, will basically high blood sugars have an impact on this?
Yes. Yes. See, one thing is that if you have undergone the surgery, then in case if you're seeing the spots in your eyes, then I would recommend you to go to the doctor and get your eye test done once again. There are chances it could be because of the high sugar level, but let's not work on the assumption. You have glucometer at the house. So please make sure to check your glucose level, your post-meal, your random, and your fasting sugar level. So this way, even you will understand, you will also have that realization, take it, my blood sugar level is within the normal range.
Got it.
And sorry, Shifa, to interrupt, but again, please check your BP level also. It's not just the sugar level, as I told you, the BP, that also sometimes causes few problems in your eyes. So get that also, get that test done also.
Got it. And since you spoke about the blood sugar testing, I think most of the people would have questions as to how often you should do that. So what would be your recommendation for SMBG or glucose monitoring?
Yeah. So now when it comes to self-monitoring blood glucose level, it depends on your glucose level. Okay. See, if you are a person with post-meal around, let's say 300, then I would recommend you to check it every day, but any one meal. Okay, that would be because I don't want you all to keep pricking your fingers. So like Monday post breakfast, Tuesday post lunch, and then Wednesday post dinner. In case if your post meal is around 300, your fasting would also be around more than 150, 160. So make sure to check your fasting on regular basis. That is one thing. Now, in case if your sugar level is somewhere less than 200, if it is 180, 170, then I would recommend you to check it every alternate days. Any 2 post meal. Okay, one is post breakfast, then take a break, and then post dinner, and also fasting sugar level. But make sure, I've seen many people doing this mistake. They check fasting sugar level not as soon as they wake up. They just go around, they brush their teeth, they go to the washroom. So by then your sugar level would be spiked, because you need energy, right, to perform these activities. So make sure that before you step down from the bed, make sure to check your glucose level. Okay, so just settle down like for 2 minutes, be in bed, and then check your glucose level, fasting glucose level. In case if your glucose level is somewhere below 140, the post-meal sugar level, which is ideally, that is what we expect. Okay, if you're a person with 200 and you have reduced to 140, okay, then that is good. Try to maintain it 120 to 130. Ideally, it has to be 100 to 120, but 130, 140 is what you can target. Okay, so now if it is less than 140, then weekly twice is what I would recommend to check your post-meal sugar and the fasting sugar levels. But yes, do not check on the weekend, because I know the post meal, everybody's, it will shoot up on the weekend. So weekend also you should check it, because you will have that realization. But then again, make sure that, weekday is what, that is a routine that we consider it as. So yeah.
There are a couple more questions, Anusha. I'll just quickly, finish them as well.
Sure.
So one question is, so they're saying that they have a little bit of blurred vision, but their retinopathy tests are normal, and their HbA1c is around 6. So what would, you suggest for them?
Okay, so here we can focus on the nutrient deficiency. Okay, so I think you need to take food that are rich in vitamin A. Okay, so there's certain the other nutrients, vitamin, the carotenoid. So make sure to eat good amount of carrot. Okay, to eat good amount of leafy vegetable. All these colored vegetables is what you can take. But again, as I told you, not weekly once, have it regularly. That is like very important. Okay, so aaj apne agar carrot kha liya doesn't mean next Friday you're going to have carrot. Make sure to have it on regular basis. That is how your this thing would be fine. And also check your blood pressure level also once. I think I would recommend that. Yeah.
Got it. So we'll just take one last question before we end. And this question they're asking, which is the best protein for breakfast? Is it tofu, cottage cheese, or boiled egg? What would be your suggestion?
When it comes to protein, I love the questions about the proteins. So see, now for vegetarian, surely I would suggest tofu. Tofu is better than paneer, okay? Because again, the paneer has carb content and tofu is made of soy. But now you would be thinking, okay, what about the thyroid person now? So yes, in case if you have thyroid, then you can have sprouts also, not just the tofu and paneer. You can have sprouts. You can even have this boiled chana. This is what I usually eat at my home. So early, like for breakfast, I have this boiled chole at times, boiled rajma at times, or sprouts at times. Paneer usually I do not have. I have it during the lunchtime. But yes, paneer also you can take. If you wish to take paneer, you can take that. But at the end, see, biologically speaking, scientifically speaking, in case if you're a person who eats egg, you can start, you can include eggs in the breakfast, because it is the high biological value of the protein, which means that all essential amino acid is present in that egg white. Okay, in the whole egg. Okay, so please make sure to have egg for breakfast if you can.
Got it. So I think that was the end of it, Anusha. I think we've it's almost 6 o'clock, so I think we can end the session here.
Yes.
Thank you so much again. It was such a wonderful session. Thank you so much for answering all the questions so patiently, and I think it's really informative for all the audience as well, right? So if you did enjoy the session, definitely you can go ahead, just drop a thumbs up in the comment section, so we know that we can continue doing such sessions. And again, thank you so much, Anusha, for such a wonderful session. I just want to thank the audience as well for being so patient and asking such wonderful questions.
Thank you for having me. And in case if anybody has doubts, I don't know how you can reach out to me, but yes, you can just Google it. And yeah, one more thing. But yeah, when it comes to Google, my last advice for you all would be just look up for the research article. Okay, if you want to understand any information, just look up for the research article. Do not Google. Okay, if you just type, "I have a pimple on my face," it will give you the answer that you have cancer. So please make sure that do not Google it. Look for the research article. And also, I hope this session was really informative to you all, and I hope you all enjoyed today's session. So thank you so much, Shifa, for having me.
Yeah, thank you so much, Anusha, and also to all the audience. Like we also have a Sugarfit app, which you can download, and we have a Q&A thing there as well. So any questions you have, you can drop it there as well, and our health coaches will help you. But thank you everyone for joining in, and thank you so much, Anusha, for your time, and hope you have a great evening ahead. And thank you everyone. Hope we'll all see you next Friday. Yeah, thank you, Anusha. You can drop off.